The 2021 Bayelsa Health Summit, which will take place between April the 19th through the 21st, will provide another opportunity for the state government to bring to the fore the many health challenges affecting the lives of the people, as well as what plans the government has to tackle these problems. Joining us now from our Rise Abuja studio to have a conversation around this is Dr. Pabara Igwele, Bayelsa State Health Commissioner. Dr. Igwele, good morning, and thank you for joining us on the morning show today.
I hope your phones are silent.
Yeah, good morning.
Hello, Dr. Igwele, can you hear me?
Yeah, I can hear you. Good morning.
Good morning. Thank you for joining us. Very quickly, Bayelsa Health Summit. What is it all about? What do you hope to achieve? If you'd like to share those details with us, we'll be glad.
Okay. Good morning, Nigerians and the rest of the world viewers. I want to thank you for this opportunity given to me to share with you the purpose and intent of the Bayelsa Health Summit. By the special grace of God, I am Dr. Pabara Igwele, the Honorable Commissioner for Health, Bayelsa State. I was appointed as Commissioner for Health on the 26th of August 2020, and when I was appointed, I had to discuss with my governor to know his plans for the people of Bayelsa State, and by the special grace of God, we discussed extensively, and we came up with a plan on how to improve the healthcare system of Bayelsa State. And permit me to build a background of what the health system in Bayelsa State looks like and the entire federation in Nigeria. And by the special grace of God, we, the electorate, I often say this in every platform, wherever I have opportunity to discuss with the people in every fora. We, the electorate, we have successfully boxed our governors and our leaders to a corner where what happened in the health sector, I often say, about 95% of what happened in the health sector are programs, are things you cannot appreciate and substantiate. You cannot hold forth with, you cannot measure tangibly. And just about 5% of what happened in the health sector is what you can appreciate and hold. Those are the infrastructures. About 95% of what happened in the health sector are programs. For example, the malaria eradication program, you have the HIV program, TB eradication program, and the COVID, that is the advent of COVID, and a lot of infectious diseases and non-communicable diseases. These are programs that government spend a lot of money into it, and you do not substantiate and appreciate what happens there. And so the electorate would not want to accept the government to the fact that when the government invests such amount of money in those programs, they will say, you have spent so billions of money in programs in the health sector, but we cannot see it. And so this is what our electorate, we had boxed our governors, our leaders, our president, to ensure that they now invest more on just the 5% of what happened in the healthcare industry. And that is not acceptable. And so my governor, by the special grace of God, after discussing with him, gave the mandate that we set up a health summit in Bayelsa State, where we holistically look at the healthcare issues, look at the healthcare problems, the challenges faced by the healthcare industries in Bayelsa State. And at the end of the summit, we'll be able to develop a blueprint, a document, a working document, by the special grace of God, that the Bayelsa State government is going to present to the State Assembly that will act as a health act in Bayelsa State. Now, who are those that will be part of this summit? We are, by the special grace of God, expecting all commissioners of health, past commissioners of health in the Ministry of Health in Bayelsa State, the current and past permanent secretaries in the Ministry of Health in Bayelsa State, all directors in the Ministry of Health in Bayelsa State, and past directors in the Ministry of Health in Bayelsa State, the leaders in the various unions, Nigerian Medical Association, the Pharmaceutical Association of Nigeria, the Nursing Association of Nigeria, Medical Laboratory Sciences Association of Nigeria. We'll be expecting provosts of the deans of the colleges of health sciences, VCs of the medical universities, deans of the faculties of clinical science and basic medical sciences in the Niger Delta University and the Medical University. By the special grace of God, we need to sit down as a people and begin to deliberate, discuss, X-ray the health system in Bayelsa State to know what we need to do and what we need not to do. We need to discuss as a people, as Bayelsans, by the special grace of God, what have we been doing over the years that we are not getting right, that our indices is not improving. We need to discuss as a people. Inwardly, and look at the things we need to change. What do we need to do differently to ensure we get a different result? And that's the essence of the summit. By the special grace of God, we'll be able to, at the end of the summit, X-ray in every space of our development in the healthcare industry to ensure we map out everything that we need and document it. And what are we looking at? At the end of the summit, we should be able to develop a blueprint, that a 10-year, 20-year working blueprint documents that by the special grace of God, we'll be able to itemize what we need to do with funds and what we don't even need to do with funds. We'll be able to identify this by the special grace of God. And then secondly, at the end of the summit, this document that we need to develop will have a 1 year, 2 year, 3 years, 10 years working plan that at the end of 1 year, we should be able to achieve A, B, C, D, and D by the special grace of God. At the end of 5 years, we have a plan to achieve this, and this by the end of 10 years, and the end of 20 years. And thirdly, this summit hopes to bring to Bayelsans to identify and strengthen the healthcare system in Bayelsa State. Because I have noticed over the years, there has not been continuity in the healthcare system where past leaders and governments will do what they want to do, and by the special grace of God, the next leader comes in, the person wants to do what he or she wants to do. And so there is no continuity. And when I discussed with my governor, His Excellency Governor Doyediri, he said he's not going to play politics with the healthcare indices of our people. He's ready, by the special grace of God, to ensure that the health of our people, he will prioritize the health of our people before politics. And by the special grace of God, that's the advent of this summit. If the governor has said he's not going to play politics with the healthcare indices of our people, by the special grace of God, as we discuss in this summit, we'll be able to identify things at the end of the summit to ensure that when we present this document to the State Assembly and become an act of government in Bayelsa State, whoever comes as governor, whoever comes as commissioner, is going to build upon whatever we have done as a government. And so that is what we are here to do by the special grace of God.
Right, so it's good to know that you have a plan for some of the succession issues that we often see when administrations change. But you mentioned the participants that you're expecting. So what can those people expect when they arrive? And can you tell us more details about some of the issues on the agenda?
Okay, by the special grace of God, the summit will be, we are aiming to achieve improved healthcare system performance through strategic stakeholders engagement. Now, what do we expect the participants to do? I have itemized here what we need to do as a people. We'll need to sit down. There are areas in the primary healthcare, secondary healthcare, and tertiary healthcare that we need to improve upon in Bayelsa State. Now, at the primary healthcare level, we expect every participant at the primary healthcare level to look at X-ray on the issues of the primary healthcare indices in Bayelsa State, how the challenges we are facing as a people in the primary healthcare level. Now, what are the challenges we faced in the area of emergency, in the area of transportation, in the area where you have most of the people in the rural communities do not have a good transportation system to ensure that our people at the rural community get a healthcare delivery at where and when they need to get to. And so by the special grace of God, everybody will need to sit down and discuss extensively to ensure the means we need to transport our people from one community to the other in case we have an emergency. And that's what the health minister has also, the Minister for Health has also emphasized that there is need for us to improve our emergency healthcare system. And so by the special grace of God, we'll look into X-ray to ensure that our emergency healthcare system in Bayelsa State, of which we the Governor Dohediri has set up the Bayelsa Emergency Ambulance Services Scheme. We'll improve upon that. We'll look at it. What are the challenges we have at the Bayelsa Emergency Ambulance Services? We'll look at it. What are the challenges we have in the various primary healthcare service delivery in Bayelsa State? And so by the time we look straight into all of this, we'll be able to get out a blueprint from it to ensure what we need to do and what we need not to do by the special grace of God.
Right. I mean, laudable ideas you're sharing, but what do you think will be the future of healthcare in Bayelsa State? Because it's got its own peculiar health challenges. And how do you think technology can help, to scale these things? You've got a lot of people with mobile phones in Bayelsa. Their phones should do more for them as regards healthcare and the like. So,
hello, I didn't hear you. Please take it again.
Where do you see the future of healthcare in Bayelsa in the next 5-10 years? And secondly, how can you incorporate technology in scaling this future?
Okay, by the special grace of God, I hope that in the next 5 to 10 years, we will be able to do quite a whole lot of things. And that's the essence of this summit, like I mentioned to you. We are looking at a 10-year strategic plan. And by the special grace of God, at the end of this summit, we'll be able to, like I said, identify the areas that we need to improve upon. By the special grace of God, we are looking at the area in the secondary healthcare facility in Bayelsa State. It is easier by the special grace of God to refer a health personnel than referring a patient. Most of our communities in Bayelsa State are in the riverine community. And the secondary healthcare level is what has been neglected over the years. And by the special grace of God, His Excellency, the Executive Governor of Bayelsa State, is trying to improve upon the secondary healthcare facility in Bayelsa State. If you notice in his 1 year in office, he commissioned the Kayama Referral Hospital. That's the secondary level of care in Bayelsa State, where we are sending healthcare personnel, qualified healthcare personnel, to those facilities. And by the special grace of God, we in Bayelsa, most of our people are very poor people, indigent people. And so when you see them come down with certain diseases and they're in those facilities, you now refer them to a tertiary healthcare facility or a secondary healthcare facility from the primary healthcare facilities. Most of them don't even have money to get to those areas where you have referred them to. And so you have also from time placed a death warrant on these persons. And so by the special grace of God, when I was young, there's what we used to say, the flying doctor scheme in Bayelsa State. And then it was River State then, the flying doctor scheme, where you have personnel, qualified healthcare personnel, come to a rural setting, give healthcare services on a particular day, and they go back to the city, which was Port Harcourt then. But now in Bayelsa State, we want to see how we can partner with the federal government, Federal Medical Center, to ensure that we refer the highly trained, highly skilled healthcare personnel to the rural communities, to our primary healthcare services, to the secondary healthcare facilities, such that the highly skilled manpower will go to those rural communities, give healthcare delivery to our people at these rural communities. By a special grace of God, after they do that, the level of intake in those secondary healthcare facilities and the primary healthcare facilities is going to be improved. And this is what the summit entails. This is what the summit is going to look at. How are we going to strategize this? How are we going to get the manpower from the federal tertiary hospitals to our secondary tertiary hospitals by the state level? This interference, this synergy to ensure that the federal skilled tertiary hospital manpower will send them in partnership with the state government to the primary healthcare facilities and the secondary healthcare facilities to ensure that by the end of the period, the 5 or 10 year period, we should, at the level of government, ensure that our people begin to get a good healthcare delivery by the special grace of God at the end of 5 or 10 years. And how are we going to incorporate this? We are developing a model. By special grace of God, when you come to the summit, there are people who will be presenting a model where just with your phone, people at the primary healthcare level at the rural community will be able to access healthcare facilities by just dialing or hooking up to those gadgets. If they have a complaint, they hook up to those gadgets, send us information to those gadgets. See, I have social complaint, I have social complaint. And by the time they send those messages to those gadgets, people at the call center will receive those information, and by special grace, will reach out to them and begin to direct them to the nearest healthcare facility around them for them to receive healthcare.
Well, Dr. Igwele, you said a lot about plans, about expectations, about policy. But could you share with us what the Bayelsa State government has been doing with regard to COVID-19 and the immunization process? Although I understand Bayelsa State has less than 1,000 cases and less than 30 cases of recorded deaths. But what is the situation with regard to immunization rollout, the response from the people, and what you've been able to do in that regard so far?
Okay, I want to thank you for this question you have asked me, and I also want to appreciate my governor who has given us leadership in the area of COVID-19. He is the chairman of the Bayelsa COVID-19 task force team, and by the special grace of God, we have done quite well in the area to ensure we reduce the number of infected persons with COVID-19 in Bayelsa State. And from when COVID came into Nigeria, I think I was one of the commissioners. This is the second time I'm commissioner for health. I was one of the commissioners who boasted that we never had COVID in Nigeria, but I was taken aback when the first case was announced here in Nigeria, and vis-a-vis, we in Bayelsa begin to have cases in Bayelsa State. And His Excellency, by the special grace of God, from the day we had our first case, swing into action to ensure that we do not have a lot of cases in our state. And by the special grace of God, we did quite a lot of things. And when I became commissioner, we improved our testing capacity in Bayelsa State, where we went into various communities to test. I think Bayelsa showed leadership in that aspect. We're the first in the history of Nigeria to move from one community to the other to ensure we test our people. And within a week of about 2 or 3, we were able to test about 12,000 persons here in Bayelsa State. And by the special grace of God, we are still recording less than 1,000 persons in COVID in Bayelsa State. And just about 9th of April, we received the COVID vaccine in Bayelsa. And by the special grace of God, His Excellency, the Deputy Governor of Bayelsa State, was the first to receive the COVID vaccine, and thereafter I took the vaccine. My governor was not around on that date, and when he came into the state about 2 weeks after, he also received the first shot of the vaccine. And by the special grace of God, every person in Bayelsa, especially traditional rulers in Bayelsa State, they argue that they want to be the first line persons to take the vaccines, and I want to appreciate them for showing leadership also to our populace. And we immunize all the first-class chiefs in Bayelsa State, and various military formations. The medical personnel have received their vaccines, and we are doing quite appreciably well in the area of the vaccination. Thank you very much.
Well, thank you very much, Dr. Igwele, for joining us on the morning show. We wish you all the best with the Bayelsa Health Summit.